procedures I'm having done today are we are doing a mini facelift. We are doing my upper eyelids, and we're also doing fat transfer along under the eyes and up into the temples and maybe some through here. Yeah, I have a very narrow face anyway, so the older I get, the more drawn it is. So this will help bring the youth back.
So when Jennifer first came in, her initial concerns were basically that she looked very tired and that she looked a lot older than she felt.
I read a lot of his reviews and his studies, and I also was very impressed that he's a facial person. I'm here because of that. And to me, this is my one and only face, and I felt that's who I want to go to, someone who specializes in faces.
In all these facial rejuvenation cases, the synergy between treating all these different components is really important. What you want to see is a face that has a uniform and harmonious sort of look to it. Oftentimes, if you treat these areas in piecemeal and all you do is a facelift and a neck lift and their volume status is not addressed, things look a little off. You wonder why the neck has been preserved and the jawline is looking so good, but yet there's a significant amount of bags under the eyes or hollows under the eyes or extra skin. It just doesn't fit right. So it sort of signals the presence of possible surgery or something that has been done to this particular patient. So it's interesting when you combine these different procedures, at the end of the day you end up getting a result that's much more natural and harmonious, which I think is important. So Jennifer's surgery went very well. All the goals that we set for her were achieved without any complication, fortunately. We started the procedure with the fat transfer. We got a nice distribution of fat across her mid-face and her lower face and around her eyes. We followed that with a upper eyelid blepharoplasty, which removed, in her case, a significant amount of extra skin and really opened up her eyes. She has very pretty naturally blue eyes that were being masked by this excess skin. All right, so we finished up the fat transfer and the upper eyelids, and now we're moving on to the facelift. All right, Jen, turn your head for me a little bit to the side. There you go. How are you feeling so far? Good? Next, we performed the facelift and the neck lift procedure and brought things up nicely. A significant improvement in the jawline. You could appreciate that right on the table at the time of the procedure, and you know you're just going to make a big impact on the person's appearance. And then we performed the chemical peel, which adds a little bit to her recovery, but it's well worth it since everything generally takes about 2 weeks to recover from, and the chemical peel is about 7 to 10 days as well, so it kind of fits right in there with one downtime. Jen came into her postoperative visit, I think it was 3 weeks, and that's when most patients look pretty good. Occasionally we have a patient that requires a full 3 weeks to recover from. However, the majority of the patients are pretty well recovered by the second week.
And it's so nice. All the people I see, they're like, you look so rested and wide-eyed, and it's just beautiful. The changes have been way beyond what I expected. My eyes, to me, are my focal point. I love my blue eyes, and now they're just like, wham. I've never had any procedures done like this. I did it for me, just to rejuvenate myself, because I'm young and active, and I was having the sagging skin and the droopy eyes, and it just opens a whole new world. It has definitely changed my everyday life, and it will continue to. I am very happy with his work and his personality.